can treat you because I never did this before, doing panchakarma. And I said, you're not doing panchakarma on us. You're doing just some supportive therapies. He said, that's true. I said, then you're fine. Unmanageable in my case, doctor. Unimaginable. That's because you haven't imagined it. The moment you read a few books on fasting, it's unbelievable. Now, no one needs to do it. I'm not recommending it, but there are at least 10 different ways of doing the fast. Let me see where I can show you a quick thingy on fasting. It's right here. Cancer and fasting. I think I did this lecture a few years back. There you go. Look at this. Dry fasting, liquid fasting, supplement fasting, herbal fasting, treatment fasting, fitness fasting, reduced meal fast, reduced meal day fast, low carb fast, alkaline lifestyle program, Ayurveda fasting. Take a screenshot. So in dry fasting, nothing. You just sit there doing very light things, very light movement, not exposing yourself into anything strong. Liquid fasting means you're having water, tea, soup, or juice, or a combination. Supplement fasting means you're having water and supplements. Herbal fasting means you're having water and herbs. Treatment fasting, water and therapies. Fitness fasting, everything except water, exercise, and a power routine. Reduced meal fasting means you have water 1 to 2 meals before 2 p.m. Reduced meal day fasting means skipping 1 to 3 meal days per week. You know the 5-2 fasting? That one. If you don't know 5-2 fasting, search, look it up. Low carb fast, water and 1 to 2 low carb meals per day. Alkaline life program, that's 12-step alkaline life. That just transforms your nutrition. It's like giving you 20 to 30 times more nutrients and giving you 16 hours of rest. That's the whole idea, but it's got 12 steps. It's not an AA program, but it's very similar. Ayurveda fasting means you can have water, herbs, therapies, and soup, no food. So fasting here is simply means minimizing food. Why do we minimize food? Because food is a liability. We'll talk about fasting another day. Okay, here we go. Marks, that movement. Tongue is still on protrusion, no trauma or deviation. The energy system is stable, able to demand from every angle. Able to deal with the demand from every angle. Shape means perfect proportion. Shape means, ovoid, symmetrical, left and right hemisphere, neither too wide nor too narrow. Organs and structures are in correct form and proportion. You know why they put some kind of fluffy cover on guava fruits, apples, expensive fruits these days, so that they don't get squashed. When all these organs are staying in the right place without getting squashed because of mechanical issue or bad chemistry induced mechanical issue, whatever that is, then they start working. Now, when all these fluffy coverings are working properly, fruits arrive in the shop all clean without a single scratch. So we got a body with all the musculoskeletal walls and propped up by various other bones and series of bones with muscles and ligaments and tendons. The whole idea is to make the body work the best possible way. And then you got a twist in your neck and a kink in your lower back and a pull in your, calf muscle, then it changes the whole biomechanical symmetry. How can we see the movement on the photo? You can't. So this is when what I do is this. Even though I've written down all those things, that's a good question. Imagine your phone starts moving. It's called video. So when I do the tongue analysis, I might ask a patient to stick their tongue out. I can't see a thing except whether it moves or not, tremors or waves, sways, etc. Just for that. But think about this: if I feel like there is something wrong, I can ask them, and I can see the tremor or swaying. Just as report, write it, right? Shape, overt, symmetrical, organ system. So organs are in the right place so that they can all work together. I don't know whether I told you, I'm going to repeat it anyway. The guy, 64, 65-year-old guy, comes to see me with this interesting request. Can you do anything to prevent post-surgical infections? Because I'm a friend of that. I get post-surgical prescription constantly. And I've had lots and lots of surgery, and surgery is fine, but for the next year, I'm in so much trouble with the infection. Do you know why people get post-surgical infection? Can you write it down? There are only very few people who do this. Write it down. Why do people get post-surgical infection? Just give me one word, not more. One word. That's the reason. Anastasia says Ama. Cliff says Orges. Michael says Orges. Any more answers? Agni, aura, trauma. Okay. Look, most of those answers are correct. The answer I was looking for was Ama. Now, why you said Agni? When the Agni is weak, Ojas is weak, what you get is Ama. So you're all right. Low immunity, same story. So Ama is the reason. So what I did was I suggested a gallbladder cleanse. I wanted to give him a Snehavanam and Virachanam, but I was not in a position to do that. Also, he didn't have 3 weeks to do that, so I thought 16 hours, 3 times a month. He does the olive oil, Epsom salt, gallbladder, what is it? Olive oil, Epsom salt, and grapefruit juice, apple juice, and water cleanse. So look for this gallbladder cleanse. You'll see the same thing. Also, say Halder Clark, gallbladder cleanse. You get this information. It's an amazing thing. So we did this. He had 6 weeks. So I thought 1 month cleanses, herbs. I gave some herbs, something like Amapajana, bitters. So I think it was Tikta Kashayam, Guluchari Kashayam, Amrutotram, that kind of stuff. And in between, I was giving Mritu Shodhanam, mild laxative with Epsom salts or magnesium oxide. And there's no lemon juice in it. It's grapefruit juice. Yeah. So Epsom salt, olive oil, grapefruit juice. There's a bit of apple juice and water as well. So it's that's it. We start at 6 p.m. and finish the whole program by 8 p.m. But you still poop a lot until lunchtime. After a soupy lunch, all done. So Saturday evening you start, Sunday lunchtime you finish it completely. You're ready for Monday work. Okay, so here shape indicates how organs are sitting together. Oh, what's that? And surface, we saw this surface is all about the buds, slightly convex raised, sorry, the raised middle, in the middle. So it's like the hot water bottle when it is filled appropriately, the middle is going to be raised. Internal pressure, we need pressure, say 6 o'clock and someone knocks on the door. That must be my dad. He's taking me for a walk at 6:50. It's a good pressure. Eustress. It's a good stress. It's a eustress. So, like your partner asking for a cup of tea, your children asking for something, your wife asking for something else, your mom wants you to drive over to her house, have a kilo of tomatoes. They're all good stress, generally speaking. So this stress keep you alive meaningfully. So the whole idea is this: having pressure and stress inside the system. Mention about laxative for each organ, pancreas, spleen. Could you please enlighten? I can't do that right now, Adria, because that's a whole course. I'll teach you. It's called Kerala Ayurveda Prescription Protocol. Write it down. One day it'll be on our website, and you can do it. That will teach you to do the best prescription, most accurate prescription, better than any amazing Ayurveda doctor ever. So it's a prescription protocol workshop. And Annie says, what's the difference between the Andreas Morse's program? I don't know anything about Andrea Moritz program, Nanny. So give me a link. I'll study it and report it tomorrow. And texture is the buds. So the more buds you see on a tongue, the better. It covers all over the tongue, the best. They are pinkish red and bright pinkish red, and they got a little white bud on top of it, even better. So taste buds or papillae. Tissues are firm, responsive, ready to defend, recover, and repair. That's what it means. And the last one is thickness. Thickness indicates lack of accumulation, toxicity, etc. Neither too thick nor too thin. Optimal substance. Optimal substance. It's like this. You got a living room. There are sufficient sofas and I don't know entertainment stuff. Imagine 15 different TVs in a living room or 2 different TVs in a living room. It'll be too much. It's hard to clean all these surfaces. And within no time, it'll be dusty and dirty and bugs start living in there. Same story in the body. The more you eat, the more you need to process, but you can't do that. This is why they say 1 meal a day, you're super fit. Or a super fit person only needs 1 meal a day. 2 meals, you are a rogi, means you're open to disease. 2 meals, you're open to disease. 3 meals, 2 meals, bhogi, reckless indulgence. 3 meals, you're open to diseases. 4 meals, they don't talk about it. No one ever thought we could have 4 meals a day every single day. Right now, one of my friends who had 5 meals a day, it was a mess. I told you about it. Sciatica, water therapy, dropped 7.5 kilos, and started feeling better. Then introduced vegetables, lots of vegetables before breaks and lunch. Then he couldn't eat breakfast and lunch except the vegetables, and he started feeling better. It's like dramatic improvements. We got a course called what is it? It's about food. Alkalization program. That's the whole idea about the best diet for every disease. Because every disease has got 2 aspects. One of them is deficiency, the other one is toxicity. When you address deficiency with surplus nutrients, easy to absorb, easy to retain, then that will attack the toxins, and we need to help the toxins to get out. So with this diet, there'll be some kind of laxatives or cleansing program that you're familiar to. That's it. Most diseases will disappear. What if I want to add kashayam pill and yeah, you can speed it up. Looking forward to it. Okay, so this is what we did today. I want to do one of your tongue pictures before we go home. La 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 la. Oh, this is a good one. Copy it. La 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 la. So what I'm going to do is I'm going to download it and I'm going to open it. Good idea? And I'm going to put a little line in here to see whether it's a straight midline. I'm happy with that. So what I'm going to write here is normal. So I'm going to copy that. So whenever I see color, I would say for the time being normal. Edges, dented, bulged. So not normal. Coating, almost normal, coated intestines. Marks. Can we see any mark here? There's an esophagus. There are some gutters on both sides. There's a deep cut over there. Marks. Little cuts. Chest area, esophagus area. There's a little dip, a little missing bit, missing tongue tip. There are so many little cuts over here, indicating little cuts on chest. So I'm going to add left lung. I think that's it. I need to get rid of all those things. The neck is also there. Okay, neck. What is going on? Okay. Okay, I think that's it. So we're trying to analyze this kind of stuff, okay? So if you can go to that picture on the WhatsApp, then you can also see it close by. Movement, I don't know. Shape, kind of normal with a kind of rectangulation. I'm going to make a new word, rectangulation. Surface, it looks normal. Texture, can you see the taste buds? They're not red spots, they are red nicks or cuts, or the papillae missing, taste buds missing. So texture, taste buds, I should say pretty good. Most areas they're pretty good. When it comes to liver and spleen areas, lymphatic system, normal, except the liver, spleen, lymphatic system. Not happy. Thickness, I would say it's normal. So this is what I get from this analysis. How long did it take? Exactly. Now we need to come up with a conclusion. We'll do that. We'll do a few more before we start making a conclusion, because when I do too many elements together, it's really annoying for most of you. So I'm going to stop it there. Quarter intestines. And if you want to change all these little things, you can. See this? So after a while, you don't need to, see, these are all fine. And if you want to make it smaller, you can by clicking. There you go. You just need a record, a clean looking record. That's it. So this is, I don't know how many of you know that it's Google Docs. It's pretty easy. So I go to my Gmail, click on the 9 dots. I can see my drive here, or Google Docs here. I go to the drive, and I click on it, it opens. This is what I can make. Google Docs, Google Sheets. Anyhow, it's not a tech training, is it? Okay, so what I did was trimming it down, enlarging it so that I can see it properly. Also downloading it and making it, playing with it. Now, one thing is this: when I talk about the shape, I missed one thing, which is left hip rotated forward, indicating rotated. That's all it is. So I want you to think about this and come up with a story tomorrow. Come up with a story. If not seeing the person to know the tongue has a tremor, can you ask people to send a video? Definitely. Definitely. You can also ask them whether they have it. But the problem is this: when they look at the mirror, the tongue starts shaking. Video is a fantastic idea. I do that if I think I need it. People, what are the questions? I'm just looking for that book. I'm just uploading that book. Oh, it's not really doing it. So I'm going to put it on the there you go. Cracks. Linda, I know tongue has got a tremor. Can you ask the person to send a video? Video is fine. Cracks, you say, are blockages, and if super deep also. Yeah. When you see a crack, the first question you can ask is, I can see a little tension blockage in this area, in that particular area. Tell me more about it. So they start talking about, yeah, I've got that problem for a long time. Tell me how many years, like is it 2 months or 2 years or 20 years? Actually, then they give you the time, how when did it start? How did it progress? And when you do that 100 times, then you know how a 2-year-old tension is shown on the crack based on the cuts and depth and coloration, all sort of stuff. You can come up with a number. How do I tell when the diagram of the tongue stops? How do you tell when the diagram on the tongue stops? In other words, how do you know you've read far enough back onto the tongue? When you go through all the 10 criteria, Cliff, it's a long-term, example 7-day, water only fast, going for Pittawal. Constitution has nothing to do with disease, treatment, or fasting. I don't know. I think the Americans created the constitutional remedy, also homeopaths. So they've stolen this idea from homeopaths. I can tell you, no one uses constitution meaningfully in healing. I can guarantee you. At least I haven't seen them. So if you don't know, don't bring it into it. You got excess and deficiency, work with them, normalize it. The patient feels now the arm's fully functional. Okay, do some Rasayana for the next 3 months, 7 months, 20 months, send them home. But constitution is not utilized properly by any Ayurveda doctor that I know. None of my teachers, none of my colleagues, none of my juniors. Ask them, they just beat around the bush because they got it from American textbooks. So yeah, Vada with the constitution, nothing to do with it. Vada with the excess. Now fasting is done for a particular reason. You are not applying, enforcing fasting on everyone. There are a number of factors. One of them is understanding about fasting and willingness. Okay. Nani says, regarding tongue movement, I have noticed that people with Vata constitution tend to have more mobile tongues. Look, some people say I'm too sharp, and I like that. So constitution has got nothing to do with it. To what extent should this be considered a clear sign of imbalance rather than simply a manifestation of Vata gunas? Now, chala doesn't mean a person has to be shaky and shivery. Gandhi was of Vata type. He was not shaky and shivery. If you have a shaking, shivering problem, that's a disease, nothing to do with the constitution. Shaking and shivering. Dr. Davis says, does the depth of cut correspond to the level of tissue, organ? Exactly. You can see some of these cuts are according to the grains of the muscles structure over there. So when you have disc compression, you'll have a cut across that little area, just like the little shape of the disc. In the cost muscles stressed, you get some kind of slanted, diagonal kind of forward slash backward slash kind of cuts. So anatomy and cuts are really interesting how they're connected. So that's something to play with. So hopefully we'll see a lot of tongue pictures to show you, to display on the screen. We got -3 minutes, but I'm happy to take a few more questions. So one thing is this.